Good afternoon, one and all. As you all know, we are celebrating International Breastfeeding Week 2023, and today is the fifth day of Breastfeeding Week celebration. First of all, I would like to introduce myself. I, Sonali Atre, I have completed my Masters in Nursing from Bharati Vidyapeeth Deemed University College of Nursing, Pune, with the specialization in obstetric and gynecological nursing. I have total 9 years of experience in nursing field. Currently, I am pursuing PhD in nursing and working as a clinical instructor in Bharati Vidyapeeth Deemed to be University College of Nursing, Pune. We will start with today's session. So our today's topic is baby friendly hospital initiative. The baby friendly hospital initiative was launched. We also called it as BFHI. It was launched by World Health Organization, that is WHO, and United Nations Children's Fund, that is UNICEF, in 1991 following the Innocenti Declaration of 1990. This is a global effort to implement practices that protect, promote, and support breastfeeding. The process is currently controlled by national breastfeeding authorities using global criteria that can apply to maternity care in every country. Implementation guides for the baby friendly hospital initiative have been developed by UNICEF and WHO. So, as we have discussed, the baby friendly hospital initiative is globally run by the WHO and UNICEF, and the implementation guides for this campaign have been developed by UNICEF and WHO. So, what are the aims of baby friendly hospital initiative? The first aim is to initiate global assessment and accreditation. Second one is to enable the mother to acquire the skills needed for breastfeeding, to assist the mothers who are not breastfeeding, and to implement baby friendly hospital initiative in the curriculum for the health worker. So this baby friendly hospital initiative is a ultimate aim of this campaign is to educate the mother or train the mother to acquire the skill needed for breastfeeding. The mothers who have not a knowledge how to breastfeed, maybe the mothers are primary or the mothers who are not breastfeeding their child, and to implement the curriculum for the health workers or to train them. Before going to the assist the mothers, we have to train the health workers and motivate them to give the knowledge to the mothers who are not breastfeeding or to assist them for breastfeeding. Now we will see the 10 steps of successful breastfeeding. According to Baby Friendly Hospital Initiative, a maternity facility can be designated baby friendly when it does not accept free or low cost breast milk substitutes, feeding bottles or teats, and has implemented 10 specific steps to support successful breastfeeding. So according to this campaign, every maternity facility should have these policies of baby friendly hospital initiative. Every facility providing maternity services and care for newborn infant should. So first point is a have a written breastfeeding policy that is routinely communicated to all healthcare staff. So first of all, there should be written breastfeeding policies in every maternity facilities. So not promoting infant formula bottles or teats. That means no any other substitutes rather than breast milk. So for that we called it as a exclusive breastfeeding. Then making breastfeeding care standard practice and keeping track of support for breastfeeding. Second one is train all healthcare staff in skills necessary to implement this policy. So as we have discussed, not only for this is for mothers or relatives whose mothers are breastfeeding, but train all the healthcare staff in the skills necessary to implement this policy. Training staff on supporting mothers to breastfeed and assessing health workers knowledge and skills. Then Third one is a inform all pregnant women about the benefits and management of breastfeeding. So there can be various hospital support groups for mothers to breastfeed by discussing the importance of breastfeeding for babies and mothers and preparing women in how to feed their babies. So this can be done in antenatal period only, so that mothers can educate by their own how to breastfeed the child in the postnatal period. Fourth one is help mothers initiate breastfeeding within half hour of birth. Yes, this is very important. So there should be hospital support group for to help mothers to initiate breastfeeding within half hour of birth. Encouraging skin to skin contact, that is rooming in between mother and baby soon after the birth. So it can be beneficial not only for the baby but also for the mother, and helping mothers to put their baby to the breast right away. Fifth one is show mothers how to breastfeed and how to maintain lactation even if they are separated from their infant. So there are so many positions are there. So healthcare workers should train the mothers by various position or demonstration and assist them in how to breastfeed their child. Then checking positioning, attachment and suckling. Giving practical breastfeeding support, helping mothers with common breastfeeding problems. So there are number of breastfeeding problems in postnatal period. If the mother is primary, healthcare provider has to help the mothers to support the elevate the problems. Sixth one is give newborn infants no food or drink other than breast milk unless medically indicated. So as we have discussed, it is called exclusive breastfeeding. So till 6 months of the age, exclusive breastfeeding should be provided to the baby. Giving only breast milk unless there are medical reasons. So in that, ORS solution and vitamin supplements can be given with doctor's permission. Then prioritizing donor human milk when a supplement is needed and helping mothers who want to formula feed to do it safely. Seventh is practice rooming in. Allow mothers and infants to remain together 24 hours a day. So in that, skin to skin contact should be maintained and letting mothers and babies stay together day and night, making sure that mothers of sick babies can stay near their baby. So if the premature deliveries are occurred and babies are admitted in NICU, so that time also mother should be go in the NICU and give rooming in to the babies. Eighth one is encourage breastfeeding on demand. Yes, it is very important. So the breastfeeding should give on demand of the baby. Whenever baby is hungry or whenever the necessary with the necessary timing schedule, the breastfeeding should be given. Helping mothers know when their baby is hungry and not limiting breastfeeding times. So the time schedule or time limit should not be decided by the mother. The breastfeeding should give on demand of the baby. Ninth one is give no artificial teats or pacifier also called as dummies or soothers to breastfeeding infants. So counsel mothers on the use and risk of feeding bottles, teat and pacifiers. So it may cause the infection to the child to the baby. So it should be avoided and only exclusive breast milk should be given to the baby till the 6 months of age. Tenth one is foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. For example, if the mother is primary, so the mother can be talk or discuss with the second mother or the mother who is multi gravida which is admitted in the hospital or within the relatives, they should be communicate with each other so that there can be establishment of breastfeeding support groups, and it can be beneficial to the mother and relatives. Referring mothers to community resources for breastfeeding support and working with communities to improve breastfeeding support services. Since Baby Friendly Hospital initiative is launching has grown with more than 152 countries around the world implementing the initiative. The initiative has measurable and proven impact, increasing the likelihood of babies being exclusively breastfed for the first 6 months. Thank you. In the continuation of topic of baby friendly hospital initiative, we will see some reviews. So here is first review, uh, impact of baby friendly hospital initiative on breastfeeding and child health outcomes. It is a systematic review. So one study is conducted and it is published in maternal and child nutrition journal. So objective of this study is the primary aim of this review was to examine the impact of the baby friendly hospital initiative package on breastfeeding and child health outcome worldwide. The specific research questions were designed and the literature search was conducted using the PICOS, that is participants, intervention, comparators, outcomes and study design model for evidence-based medical research. In that population was women who deliver a healthy full-term infant in a hospital or birthing center. Intervention was research question were asked, is there an impact of baby friendly hospital initiative on breastfeeding and infant health outcome globally? Comparison was done with women not exposed to the 10 steps, degree of exposure on the 10 steps. So here two groups were discussed and comparison was done with the women who are exposed with the 10 steps of baby friendly hospital initiative, and the second other group, that in that women who are not exposed with these 10 steps. So the outcome of the study was exclusive breastfeeding at discharge through 6 months postpartum, any breastfeeding at discharge through 12 months postpartum, onset of lactation, infant health outcome. So the group who was not exposed to the 10 steps of baby friendly hospital initiative uh, was suffered with the gastrointestinal infection, upper and lower respiratory tract infection, otitis media, allergies, asthma, obesity and lack of intelligence. Second review is report of All India study. The baby friendly hospitals were selected from the list provided by the UNICEF. The non baby friendly hospital were selected from the same city or neighboring city. So in this study also comparison was done with the hospitals who were exposed or who were given the baby friendly hospital initiative steps and non baby friendly hospitals. So the comparison was done within the two hospitals. Then taking into consideration the size of hospital and number of deliveries in this hospital. In public and private sector in 13 major states in India was selected for the study. Data was collected from the respondents by BPNI using semi-structured questionnaires. It was developed at the national level in Delhi and field tested in Delhi and neighboring states. The standard WHO and NNF guidelines were used to draft the questionnaires. And the objectives of the study was current practices related to free low cost distribution of infant milk substitutes to hospitals with maternity services and the implementation of the IMS Act in the healthcare institution. Second one is compare infant feeding practices between baby friendly and non baby friendly hospitals, and to study the infant feeding practices and availability of infant milk substitutes, IMS feeding bottles and nipples in the catchment area of the hospitals, compare between the catchment areas of baby friendly hospitals and others. So the conclusion or outcome of the study was breastfeeding and baby friendly hospital initiative. There is considerable interest in the baby friendly hospital initiative movement, as nearly 1400 hospitals have adopted to be baby friendly. The findings that initiation of breastfeeding has significantly improved, pre-lactal feeds have significantly reduced, and offering supplements during hospital stay also reduced significantly, promise future improvement in breastfeeding practices in the healthcare system. So by looking of these two reviews, it is clear that in which hospitals or the patients who are exposed with the baby friendly hospital initiative steps were less likely to has diseases to the newborn baby, and there was significantly reduced uh, the hospitals say, and breastfeeding practices has significantly improved with the baby friendly hospital initiative. So these are the some reviews related to the baby friendly hospital initiative. So I declare that today's session is over. If you have any query, you can put your queries in the chat box. Thank you.